Warning. Some viewers may find the following video triggering.
So today I'm stood outside Bicester SARC Centre. The SARC Centre is a Sexual Assault Referral Centre, and these exist up and down the country in collaboration with the police and with the NHS. I'm here today to have a look inside, see what the forensic side is like, and actually talk to some of the crisis workers that do work in here as to what they do to support victims.
Hi Sharon.
Hello.
Do you want to come in?
Yes. Oh,
Nice to meet you.
nice to meet you.
I'm Natalie, I'm the lead SARC manager for G4S.
Thank you so much for having me.
SARC, come in. I'm Natalie Lynch, I'm lead SARC manager for G4S, and what that means is I manage the managers of our SARCs around the country. I've been a forensic nurse examiner for about 7 years now, and I'm a degree level nurse, been nursing for 30 years. Our roles also include crisis workers, and I do that because it's a really lovely role, so sometimes I'll jump in and be crisis worker because I want to, it's nice.
If there was a person that wanted to come to the SARC, how would they get here essentially?
So there's two routes, essentially. The first route is you can just ring the police and say that you've been raped, and the police will mobilise you into the SARC really quickly. The second route is self-referral. So I think a lot of people don't realise that the SARCs even exist, and they don't realise that they can come here and receive exactly the same service as they would if they came with the police, but without the police. So you go on Google and say SARC near me or I've been raped, and it will give you the details of the phone numbers to ring in order to get put through to somebody. Normally what happens is that you're put through to a crisis worker, and the crisis worker will check that you're okay initially, and then they'll ask you a set of pro-forma questions to work out what it is that you need. So obviously there are time limitations on attending the SARC, but the SARC is a Sexual Assault Referral Centre, and at any point in your life, if this has happened, you can come to us and we'll make appropriate referrals with your permission. But it might be that this thing happened many years ago and you've reached a point where you're not coping and that you need that additional support. That's what we're here for. We're here to put you through to the right support services so that you can recover. Another route in is if you've spoken to a healthcare professional. You might have been to your GP or been in an A&E department, and they might do the referral with you, for you. We always have to speak to you in order to book you in as a self-referral, but they might make that initial call. So if there is someone that you trust, a GP, a practice nurse, someone that you trust and you're struggling, speak to them, they can make that initial phone call, and then we can speak to you and get you into the SARC.
I think one thing as well with people that do want to come to the SARC or want to come to a service like this, sometimes they can be quite scared about who they're going to speak to initially, especially if you're within that first 24-hour period. How does the crisis worker get paired with the client essentially?
So we have rotas, so there will always be somebody on 24/7, 365, and you will always be able to get through to a crisis worker. So you ring the number and they will put you through to the crisis worker who is on duty. Our crisis workers are really well trained. They're trained in management of clients' feelings and trauma informed, and we try not to keep asking the same questions again and again because we recognise that re-traumatises people. So if you've given your account to one person, that account is then passed through our services, through our people, so that you're not asked to keep repeating yourself. And we're really aware that that can cause problems.
Earlier you spoke about time limitations when it comes to coming to the SARC. What are those time limitations and how does that impact your service or time at the SARC Centre?
So if it's a vaginal rape, we have 7 days in order to take forensic samples. If it's an anal rape, we have 3 days. If it's been skin, we have 2 days. So if it's like a touch. So there are limitations, but what we always say is if there are injuries, even if we're over the 7-day period or over the 3-day period, we might still want to bring you in so that we can do forensic documentation of those injuries and perhaps take images of those injuries. with your consent obviously. In terms of the ongoing care, you're still going to get all of that. First place we take you is in here, so this is our pre-examination room. I'd be in gowns, but today we're just going to have a little look around.
Amazing.
So welcome, come in.
So is the process for when any person walks through the door pretty much the same in any SARC centre?
Yes. People come in here and they've had choices taken away from them, and it's about re-empowering them, giving them the option to pick and choose the bits of this process that they are comfortable with, that they want, that will then help them to recover in the long term.
Yeah, I guess it's all about that element of choice and their ability to kind of, like you said, take that power back, but have that little bit of independence back as well.
Absolutely. And the process is quite big. I mean, we do a lot of things. We'll take histories, and then what we do with that history and what we do in the examination can be quite lengthy. And it's about explaining to the person sat in front of us what that looks like and how that will then affect the ongoing long-term process, to allow them to make informed choices so that they understand, if they make a choice, what the repercussions for that might be. So when we call it consent, it's quite long, but it needs to be, because that person needs to really understand what it is that we're doing for them, never to them, for them, and why, and what that might look like.
So after they've come in here and had that initial conversation, what happens next?
So they're actually going to be in here for about an hour.
Okay.
So they'll spend some time with the crisis worker, and the crisis worker is a person who is dedicated purely to them. And they will be with them right from when they arrive here until they leave. And the crisis worker's job is to make sure that they understand what the client needs from this interaction.
I know that it's not necessarily something people think about when they have been a victim of something so horrible, but how can they prepare? Like, what do they bring with them to the SARC?
Okay. The crisis worker is always going to have that conversation with the client. So the crisis worker will have asked you very specifically, can you tell me what's happened? What we find is sometimes people struggle to actually say it. So the crisis worker might say, did this happen, and then the client only needs to say yes or no, and we recognise that might make it easier. Examples of some of the things you might be asked to bring in are the pair of pants that you wore at or after an incident, and if you have a sandwich bag at home, just pop them in a sandwich bag and seal it. That's the best way of bringing them in. If it's been an oral assault with your mouth, then we might ask you to bring your toothbrush if you cleaned your teeth, because that holds really good evidence. Occasionally we ask you to bring clothes if there's any bodily fluids on them, but it's usually more limited to things like underwear and toothbrushes.
How does a client's experience differ if they self-referred to if they came with the police?
So when they come in with the police, there's like the golden 24 hours. A lot of investigation goes on within that initial period of the 24 hours. The samples that we take are tested by the police, and they obviously have the full support of the police right from day dot. Sometimes people aren't ready to report to the police, but it's absolutely essential that they come into us as soon as possible so that we can collect that evidence. The evidence for a self-referral will remain on site here. It's all under lock and key, and we can hold that for 2 years, which really gives somebody time to make choices as to what they want to do.
So who can use the services at the SARC?
So we have clients any age from birth right through till 120. Children have to come through as a police referral. Older teenagers, 16, 17-year-olds, they can self-refer, but we have a statutory obligation to let social services know that they've been here with us. Doesn't mean that social services are going to go out and speak to them, but we have to make sure that they're aware that that child has attended here. We see all genders here. Back in the day it was male and female, and now it's not. There's everything in between, and we want everybody to feel comfortable coming into the SARC. Our examiners are used to seeing people of different genders. So this is the examination suite, and again we would normally be gowned up, scrubbed up to go in here. So let me invite you through. So it's a nice room, it's a nice space, and the crisis worker is going to sit at this end, and they will be there to support the client. Usually they have a nice conversation about things that aren't going on down at this end, and we will go at the patient's pace. So again, we will ask permission to do anything. We're really conscious that some things might trigger you, so we're gentle, and we just try and make sure that that person is comfortable with what it is that we're asking to do. The swabs are cotton buds. They're really soft on your skin, they don't hurt. I quite often will demonstrate on a person's skin before I start doing, so they can see that nothing I'm going to do is going to hurt them or be uncomfortable. And they're in here for a really limited period of time. So if they've got injuries and we need to body map those injuries, it can take longer. But the actual swabbing, we can be in and out of here in about probably 30 minutes. So this room, although it's where the examination happens, we're in here least.
Okay, I think that's really important for people to know that actually that when you say something, when you say like a SARC centre, people automatically assume this is the only place you'll be, and then straight to a police station if that's where the patient decides is necessary. But it's nice to know that actually somebody wants to listen to them and have that conversation first.
Our ethos is that we're going to believe our clients and treat them with dignity and respect. I am literally here as an agent of the court to produce samples and to make sure that my client understands what's available to them. It's not all about this. A SARC is a Sexual Assault Referral Centre. So this is a really small bit of what we do. A lot of what we do actually is the onward referrals. That's the bit where they step onto that road to recovery. So it's not all about this room.
After the client has been in this room, where do they go? What happens next?
So we go back into the pre-room or the post-room if the SARC has one, and quite often in SARCs that you'll go into around the country there'll be a pod, which is a pre-room, the examination room and a bathroom, and then a separate post-room, and that's where we're going to talk about aftercare. So obviously we're here doing swabs and collecting evidence, but actually we need to think about what happens afterwards in terms of safeguarding and onward referrals into sexual health clinics and anything that we need to do for them while they're here.
I think one of the biggest concerns that anybody or any victim has had when they go through the trauma process of like trying to go to recovery is that they don't necessarily feel like they're going to be believed, or that no one believes them and they don't have that support. So what actually happens? How long do the appointments take when they come to the SARC?
Yeah, so we'd expect somebody to be here normally for about 4 hours. Our ethos is to believe everyone and treat them with dignity and respect. I'm a nurse, it's not my job to decide whether something is right or not. I'm here literally to support that person, to make sure they get the onward referrals that they need and to make sure that that they're comfortable.
So earlier you showed me a little bit of the forensic room downstairs. Is there a particular reason why it's done inside the SARC as opposed to at a more general hospital?
Yeah, SARCs are really specialist centres. Everybody here is trained specifically in looking after victims of rape and sexual abuse, and it's around forensic DNA evidence, and whilst we can go into a hospital if we need to, if somebody can't make it back out to us, and we can go into old people's homes if they're not mobile and they can't get to us, best practice is to be seen in the SARC, just because in our forensic rooms there's no background DNA.
So at the moment we are in the SARC forensic room. I actually thought when I first walked in here that it would be actually really scary, but looking around I've probably walked into rooms like this all the time, going to the dentist, going to the GP. The smell, the look, the furniture is all basically the same, which is actually in a really odd way it's a little bit comforting because it feels a little bit normal. Obviously I've not seen anything like this yet, and I think that this is probably the part that does scare people. So I want to be able to talk through it and understand what's actually in here, what is used and how the process really works.
Absolutely. When you're in a forensic room, this is what you're going to see, and the crisis worker will also be in scrubs, and we double glove, and that is standard. That's what you'll see everywhere. So this, we're comfortable, it's good, it's all fine. And this is a police evidence bag, and in it contain all the modules that we might use in an examination. Not all of them necessarily, but probably some or most of them. So if we just open this up, and we'll just take some of these out.
So a second ago you just said this is a police evidence bag.
Yep.
If you decide not to go down or speak to the police, it's just because it's the way it's packaged as opposed to...
Yeah. We use exactly the same kit and caboodle, because if then at some point in the future as a self-referral you choose to report to the police, it is this that we will hand to the police with your permission.
So my only experience of a SARC is on TV dramas, like quite a lot of people, and the only visual I really saw of it was very clinical, a little bit inhumane, but also there was a lot of police uniform present, which I can imagine can be very scary for any client who wants to use the services at the SARC. What does it actually look like in reality?
Okay, so even before the client comes in, the crisis worker is going to have quite a long chat with them about what it is that they want and what they don't want. So if we've established that's really off-putting for them, then they don't have to have police officers here even at all.
What is the process of somebody that attends the SARC and uses the services?
Okay, so it's really important that our clients are given choice. And so we spend a long time with them we call it consent, and it's a long list of choices. And so we go through really carefully with the client what each of the choices are and what the outcomes are. So they then are able to make informed choices because they really understand what it is that they're picking and choosing between. And even if they say when we're doing consent that they agree to all of those things happening, they can say stop at any time. So even if they say, I want you to take all of the samples, if we get into the forensic medical examination room and they think, actually, I don't want you to take those samples, they can just say, actually, I've changed my mind, and that's fine, we'll support them whatever their choices are. What I find when I'm examining is something that can really be off-putting to people is this room. Yeah. And so quite commonly, if I know that they're anxious about what's behind that door, I'm going to open the door and just let them peek in and see it, because that I find really helps. The other thing that makes people anxious is when they walk in, and we've laid all these out ready to do, because there can be lots of them, but the process is really quick. Like, I can have the whole lot done in, perhaps even 10 minutes if it's a really short one. But when they're all laid out along the bench, people can be a little bit anxious about that. So I think it's really important that everybody gets to see this, because this is actually fine. So this one is a couch cover. So you know the blue roll you get when you go to the GP surgery? Yeah. This is the equivalent of the blue roll, but it's a DNA grade. So that would go over the couch. We will normally ask our clients to change into a patient gown. Okay. So what we're going to ask them to do is to take all of their clothes off and to put on this. You know, when you go to theatre and you have like a gown on? Yeah. Yep, it's like that, but it's the same material as this. Okay. And again, it's DNA grade. If you have had anything to drink or there have been any drugs disclosed, we would ask you to do a urine sample. So again, when you go to the GP surgery and you take a little vial of urine in, we might give you a little plastic beaker and say, please can you wee in that? Okay. This is your choice. You don't have to. Everything is a choice. So I'll just open this and you can have a look at it. So in here are 2 pots. We would normally take 2 samples and we would take them an hour apart. So wee number 1, wee number 2. The little tablet in there is a preservative. Okay. So when you've weed in here, we tip it in here, shake it all up, fill in the forms, stick it all together and put it in this one and seal it.
Okay. I've never actually seen a preservative.
So you won't see preservative in the GP one, but that's what that is. We're going to have that. We're not going to give it to you as a client. We're going to ask you to wee in that one if you can. When that's done and sealed and got all the right things on it, we seal it in that, and then that goes into an evidence bag. So if you start to look at what it might look like for a client when they're coming in, it's going to start to look a little bit like this. And that is sometimes why people start to get a little bit anxious, because they start seeing these piling up. Yeah. We're also going to ask you to keep the tissue that you wipe with after you've been for a wee. Okay. So we've got 2 of those, because that one belongs with that one and that one belongs to that one. And you can see it really quickly adds up. Yeah. But it's just 2 urine samples.
Yeah, I mean, majority of what I've seen so far is either way to preserve it with packaging or PPE.
This one is an alcohol blood drug collection. If you think that you were spiked, or that you perhaps had a couple of drinks and you were way drunker than you thought you should have been, again, we might ask you if we can take a blood sample. Now there's a time limit on that, yes, as with some of these things, but again, it's just a blood sample. So we'll pop a little needle into your arm, take a blood sample and pop it into these, okay? Standard swab kit. So we're going to be taking some samples with your permission from your skin and from areas of your body. So I want to show you this one. We work in 2s.
Okay.
One wet, one dry.
Right.
And the wet one allows us to just moisten any DNA that's on the skin, and the dry one then picks it up.
Okay.
So very commonly your swabs will be done in 2s, and your examiner is going to talk you through that, or your water vial even. Put some drops on it, and if I have your hand, you can see how gentle this is. It's a roll. Okay?
Okay, yeah.
And that is as simple as it is.
Yeah.
Okay, so we're going to do the wet one, and then we're going to do the dry one. Okay? So we'll talk through with you beforehand the areas that we might want to sample, and it will be based on the account that you've given us, and we will work out the bits that we ought to swab in order to collect the most evidence. So if there's been that they touched your wrist, we're going to sample your wrist and your opposite wrist, because what we would expect to find is more DNA on this wrist than on this wrist. So it's opposites and double, okay? So then if we need to sample from your vagina, with your permission, we're going to do these samples. And again, it is exactly the same. It's one wet, one dry, and we work in 2s. So we then set this up over here.
Do you use every single swab every single time?
Absolutely not. And I can have all these laid up, all of them written on, ready to go, and you as the client go, actually, do you know what? Don't do that to me.
Okay.
Absolutely fine. We always say to our clients, you can say stop at any time.
Okay.
We use a lubricant. That's the water for those swabs. This lubricant we're going to collect as a sample. So again, we have another one to add to our list. It's going on there. And we're going to use the lubricant, with your permission, with a speculum.
Okay.
Now, anybody that's been to a GP surgery or a sexual health clinic will have seen one of these. And it is a little tool which allows us to open the vagina and to keep it open so that we can see inside, look for injuries. We can get our swabs right to the back into the areas around the cervix and get it into the cervix. So those are specific samples that we take. And it looks like this. It's like a duck's bill. Okay? And the way we do it is we pop it in, turn it around, and we open it. And then slide this little, it's like a little nut at the back, slide the nut, and then we'll probably keep one hand on it just to keep it open and we can see in.
Okay.
Yeah. All right? And the lubricant is used to make sure that when we're putting it in, it's not uncomfortable. So we apply the lubricant onto the end of this. Normally we would then need to wipe it just on the outside of your vaginal entrance. Mm-hmm. So that's normal if anybody's having that done. It's just to lubricate it and then we can pop it in really easily. It's entirely your choice if you want us to use this or not. The benefit of doing this is we are trying to just track where the incident has happened and how far up it's gone. Okay. Does that make sense? Yeah. Whereas if people are like, absolutely, I don't want that, it's just no, that's fine. What we would do is take swabs from around the vulva. We would take one that just goes straight into the vagina, and then we might take what we call a blind high. So we'd pop one of those swabs into the vaginal area and just try and get any evidence we can from the edges and pull it back out. It's not as good, and obviously this is what we would like to use, but it's your choice. But when somebody comes into the room and they might be faced with that can be a little bit overwhelming. Yeah. But if people understand that actually it's a really quick process, it's fine, and that they can see that, hopefully that will assure people a little about being in here.
And not everything is used for every single case, it just depends on...
Only lay out what we think we're going to use. So we'll have discussed it with the client previously, we'll have asked for their input, for their ideas, what they think that they can cope with and what they don't want to cope with. We'll lay up according to what we've agreed, but if they come in here and they say, actually, I don't want that sample, then we just miss it out, it's absolutely fine.
So if somebody who has used the SARC services decided at the time they didn't want to involve police or go down a criminal prosecution route, but later decide that they do want to do that, what's the process like for them?
So we can either support them to make that call to the police to say that they want their evidence to be looked at and they want to report to the police, or they can ring the police directly themselves and just tell the police that they've actually attended the SARC, and then the police will ask them to sign a form for us to be able to release that information to the police.
What's the golden time window for somebody to actually come here to be able to kind of collate that evidence before deciding what they want to do with it later down the line?
And that's kind of around what the offence is.
Okay.
So we usually talk about things like a vaginal rape, an anal rape, sexual touching, oral rape, and they each have a time frame. It doesn't mean that we won't bring you in for a forensic medical examination if that timescale has gone. If there's any suggestion that there might still be injuries, we would potentially still want to bring you in.
So after a client has been through the SARC and they need support afterwards, because like you've said to me before that trauma can come in waves, what does the aftercare look like for anybody that's been through here?
So there's kind of a couple of routes that we can do. So the first thing is crisis intervention counselling, and it's very much pre-trial counselling. It doesn't touch on the offence. It is about, can that person cope? Particularly helpful if someone is determined they don't want to tell anyone that they've been in the SARC. What's their coping mechanism going to look like? So crisis intervention counselling initially, talking therapies, so in terms of managing those traumas, and post-trial counselling. So if they've been to court, they then might want to speak to a counsellor just to help them on that recovery process. We will always offer mental health referrals if we think those are appropriate. We sometimes see substance misuse and we can offer referrals for those. Absolutely key for every patient that comes through here is a sexual health clinic referral. These are optional. You don't have to go. We can make the referrals for you and then you can choose whether you want to attend that or not. You know, that's their choice. We will assess everyone for bloodborne viruses and pregnancy. And we can offer early hormonal contraception tablets here, morning after pill, a vaccine against hepatitis B. It's one of 3 vaccines, so it's a course. And if we think it's clinically appropriate, we can also offer medication to prevent HIV.
So how do I actually find my nearest SARC?
Okay, so if you go on Google, you'll find telephone numbers, email addresses. Telephone number is the best way to contact your SARC. You'll normally put through to a call centre of trained people and put you through to the right service in the right area. The NHS also has a website which has the links to all of the SARCs on it.
So how much does it cost for somebody to use the services?
This is free. It's an NHS service across the country. It's free.
Amazing.
And all of the ongoing care is free. So all of the counselling, it's free.
From the moment a client phones the helpline and actually gets in contact with their local SARC, how long does it take from that phone call to actually being in here?
So for self-referral, it's going to be a conversation with the client to work out what works best for them. They might have work, they might have children, we might need to take those things into consideration. We will see clients in the evening if that helps them. What we try and do though is not see a self-referral case after about 9 o'clock at night, because if you imagine they're here for 4 hours, they're then going home at 1 o'clock in the morning, and we do need to make sure that people are safe. So if they're coming later, we might ask them to be here with a supporter so that somebody else is going to be driving them here and back and make sure that we know that they get home safe. If it's a police case, from the time that the police book the case in, we will usually convene here within 90 minutes with the whole team ready to go.
Thank you so much for having me. I really appreciate it. I hope you guys have found that content very, very useful and helpful. If you want to find a little bit more information out about SARCs or want to find your nearest SARC centre, I'm going to put all the links and hotline numbers and information down below. But I'd really appreciate it if you liked and subscribed to my channel. See you guys later.